our beloved Prophet ﷺ said. It's mentioned in Sahih Muslim. Our beloved Prophet said, the worst container a human being can fill is the stomach. And the son of Adam requires enough food to keep his back straight. But if it's not possible, then 1/3 for the food, 1/3 for the drink, 1/3 for his breath. So in Islamic medicine, it's recommended that you don't overeat. 1/3 of your stomach should be utilized for food, 1/3 for the drink, for the water, etc. And 1/3 for your breath, means keep it empty. And modern medicine says the same, you should not overeat, you should keep something less. So this is the core of the Islamic medicine. Now this was in short just trying to tell you the difference between the Islamic medicine, which has 3 parts. One is tawakkul, believing that Allah alone is the cure. Number 2 is ruqya, that is treating by reciting the du'as of the Prophet mentioned in the authentic hadith or the verses of the Quran. And number 3 is the medical treatment. In the modern medicine, you only have the 3rd part of the Islamic medicine. In modern medicine, I've done it. I never read. In medical science, there is no proof that God exists. There is no proof that God doesn't exist. So medical science is agnostic as far as God is concerned. Nowhere in any of the medical books I read that, God cures, that God is the healer. It's only depending upon you do your diagnosis and do the treatment. That's it. And there is no ruqya also in the modern medicine. So the difference that you find, what is the difference between a Muslim who is practicing modern medicine compared to a non-Muslim or compared to an atheist? An atheist will give medicine. You have fever, you take paracetamol, you'll get fine. A Muslim cannot say that. A Muslim cannot tell a patient that take paracetamol and your fever will be solved. He has to say, take paracetamol, inshallah, your fever will go down. Inshallah, your praise will be suppressed. If he does not use the word inshallah, he is not a practicing Muslim. This is the difference. It may sound very common. So an atheist doctor gives you medicine, says, take it, and you'll be cured. Like, confident. A Muslim cannot. A Muslim has to say, inshallah. And at the same time, when he's giving advice to his patient, he should also say that pray to God. That if he's a Muslim, pray to Allah. If he's a non-Muslim, okay, pray to God. That he gives you shifa. That's the reason while giving medicine, for a Muslim modern medical doctor, he has to use the word inshallah. This is the difference between the approach of prophetic medicine to healing vis-a-vis the modern medical treatment. When I was in medical college, I had very few Muslim colleagues who were doing the bachelor's for medicine. More than 90% were non-Muslims. And I had few non-Muslims who were religious, maybe Hindus, Christians. Many of them, they were atheists. Now all of us, where it comes to small treatment, it may look similar, but where it comes to critical illness, if a patient is on his deathbed and the doctor knows that he has very little, he doesn't have chance of surviving. And when the relatives of the patient, when they tell the doctor, what can we do? He'll not say take the medicine. Even if he's an atheist, he'll say pray to God. At a higher level, he may not be religious because he has no answer. He knows according to his medical science, this patient has to die. So what answer he gives? That we have done all what we could, the rest is in the hands of God. When I was in the medical college, I used to do dawah to my medical teachers, my professors, and my Muslim friends used to say that you're crazy, because in the medical college, there are 2 types of tests. One is written test, one is viva voce, oral test. And you have to pass in each one individually. And if if the teacher doesn't like you and fails you in the written test, you can re-examine. In the Viva voice, you cannot re-examine. Oral test, you cannot re-examine. So they used to tell me, Zakir, you're crazy. You're doing dawah to the non-Muslim teacher, he'll fail you. So I have to tell them, if he fails me, Allah will give me 1 more year to do dawah with him. That was my positive thinking. I'm optimist, not a pessimist. Because doing dawah is a fard on every Muslim. Now, if my teacher tells the patient, pray to God, I'll tell him which medical book says pray to God. I said, sir, I did not read in Harrison Ford. I did not read in Belly and Love, all these books. Which medical book says pray to God? So are you deviating away from your medical science? And at a higher level, you have to agree almost all the doctors. Even if he's not a practicing religious doctor, I'm not talking about the Muslims. Muslims, of course, they will say. I'm talking about the non-Muslims. They will tell you that you pray to God, even though they don't believe in God, because they know that the medical science is limited. They don't have the answer to the disease. They don't have the answer to the sickness. So this is the instinct that is there, even though they are not taught in the medical science. And they know that the relative's patient, maybe they believe in God or they don't, that's the best answer they can give. So you can understand the difference in the approach of the medical treatment, the modern medical treatment, and the Islamic medicine treatment.